The great thing about at-home dental is that we are going into your home or your workplace or the place you live, and that changes the dynamic. It is a far more relaxed atmosphere. You are in charge when we come to your house, and that is nice. And actually, as dentists, we don't like working in a surgical environment where people are nervous and tense and there's a quick turnaround of patients and they're in and they're out. And actually coming to people's homes make them more relaxed, and funnily make us more relaxed. You know, we can take our time, we can get to know you, and we can get to understand the problems and issues you have. So I think from our perspective, and all our clinicians enjoy that opportunity to get to know our clients and understand their needs. And as such, we do run a very empathetic service.
So our van it's got everything in it that you would find in a dental practice. So if we're going in for a checkup, we'll bring in all our checkup equipment, which is usually 2 backpacks and a table and chairs that we set up usually in patient's lounge or kitchen or wherever there's space. I've got like a little head torch that I wear on my head, which just then I can see the patient's teeth really clearly.
As we all know, we're in a country where the population is ageing quite significantly. And it's not just due to the pandemic. There's so many people who are isolated and vulnerable and in their homes. And some of them have got good families and whatever and carers to support them, but there's so many that haven't. I'm really quite passionate about this interface between healthcare and social care, because that's what we're dealing with. It's not just dentistry here, it's a bigger subject than that. It is this interface between healthcare and social care, and I feel we can really make a difference.
I didn't expect a dentist to call, because I used to go to Dendy Road, a dentist there, but of course I knew that until I knew that I was allowed dental treatment in the home, that was when I decided to have it. And that's when I asked Lisa if I could have a dentist. And he came, he was very good, very kind. It was interesting really having a dentist come to your home. Because you know, when you're sat in the dentist surgery, waiting for them to come, you're thinking to yourself what it's going to be like, you know. But no, it was quite comfortable, able to sit in your chair.
But nowadays, I'm at home for my dental treatment. The dentist comes in, I'm comfortable, I'm in my familiar surroundings, and it's very easy, no worry, if you like, no stress compared with going into a dental practice and waiting for quite a long time for my appointment.
No, my husband can't drive anymore, and he's a bit breathless and can't walk very far. It's so much more convenient for the dentist to come here when we had to go to Totnes with all the parking and also climbing the stairs in the dentist's surgery. So I decided it was brilliant to have the dentist come here, and also it saved me making an appointment as well and going separately, so we both are done together, which is lovely. And Justin's a very caring, lovely dentist and very gentle and kind, and it's sort of nice to chat to him, and it's much more relaxed than being in a dental surgery.
My wife is Connie King, who's a patient at Home Dental. She's not bedbound, but she's completely disabled, so getting to a dentist is rather very difficult. We can do it, but it's very difficult. The type of services At Home Dental provided has been a full range of dentistry, from fitting a bridge, extractions, fillings, x-rays, and all the equipment they've got is as good, if not better, than going to a normal dentist in an office, in a premises.